In this session, I want to be talking about a common injury that a lot of people in our bodybuilding or the lifting community have it for so many years, and many don't seem to know anything about it or what to do about it. I have come across that injury, not for myself personally, but for a lot of my clients and people that I treated. Um, One of the reasons for that is excessive doing or action of doing flat bench press and also overhead press. So that really affects that corner of the shoulders in the front here. And a lot of people say, well, I have pain and I cannot really do it. And as soon as I stop doing bench press, pain goes away. This injury or this sort of handicap, if I may say, uh, is termed in therapy or orthopedics as distal clavicle osteolysis. Osteolysis means this is erosion and deterioration in the bones that happens there. And because of the excessive use and excessive training in flat bench press and overhead presses, you get a lot of narrowness to the internal rotators in the shoulders, and then basically really locks the range and puts the tendons and the ligament structure here under strain. And with time, you'll find that there is constant inflammation in it there. When you stop training, like you say, and then you rest and it goes away and you come back and it happens again, it actually didn't go away. It just, the inflammation got minimized because you stayed away from that. It's a big problem that a lot of people have, and I've been seeing it a lot. It didn't happen to me ever because I don't do much of that flat bench press. I do inclines. But a lot of my clients, and I treated a lot of people with that in my clinic setting. So when you have that, first thing to do is to ice so you can actually get that inflammation down so you can feel comfortable. Then practically from there on, you want to actually consult with your physiotherapist or your orthopedic surgeon to really get some tips on how to stretch that internal rotation of the shoulders. Put your hands against the door frame or to stretch it out to open that structure, that spectrum. So you're not really keeping the shoulder capsule narrowed, or the action is more of a narrow frame like upright row and all that. This is very harmful that. So you want to actually get away from all these things and try to do a more of an open capsule, open range movement for the capsule, like chest fly, more of an incline chest fly, or pull down. We find in our clinical settings that these movements give quite a bit of relief, and they contribute to having a great range of motion for the anterior capsule structure here. And that's what happens when a lot of us in bodybuilding. So my best advice to anyone and everyone is to really, really avoid doing any flat bench press. There is a great deal of harm in it. It doesn't really focus on building the entire structure of the chest as so many people think, but it's widely common, but we've seen in a lot of clips of operations and orthopedics, a great deal of fraying and damage to the shoulder ligaments. So my advice to you today is to basically, if you want to stay in the game long and train and enjoy your training, is just abandon the flat bench press, whether you do it with dumbbells or barbell, because of the orientation of the chest, the pectoralis muscle itself on the rib cage. It doesn't really correspond well with that, and you get excessive extension to the shoulder itself. And when you're not careful doing your sets or reps with a range of motion or a 70 to 80% of your one repetition max, you try to go heavy without proper warm-up or without proper range of motion, you end up hurting yourself. So please, my best advice is to abandon that. Incline chest press will really get you a great development, but continue to get advices from your orthopedic surgeon or doctor, because if you don't really take care of that injury, worst thing is that you're going to have an operation and then after that you may not be able to do what you want to do after. So in any case, my advice is there, and I wish you all stay safe, and till next time, take care.